All right, so he calls himself the Cowboy dentist, but Dr. Collins with Manville Dental and Implant Center isn't just roping in better smiles. He's an airway, mouth, and naturopathic doctor with more than 30 years in practice, and he's made it his calling to look deeper, treating not just the teeth, but potentially the root causes of other chronic illnesses. Today, he's joined by Deborah Adams, who came to him with dental issues and left with a brand new smile, and guess what? Her knee no longer hurt. Okay, you're going to explain that connection in a second. I just want to say you have over 30 years experience in biological and holistic dentistry.
Yes.
Harvard Medical and American College of Integrative Medicine trained. The mouth is more than teeth. So when you say holistic dentistry and biological, what does that mean?
So I'm actually also a naturopath. And what that means, I'm looking for the root cause, right? And of why you have these issues. Why do you have all these pains, whatever else? So what we know is that your mouth can be an oral contribution to anything that you got going on, right? So they say, well, you have a billion bacteria that comes in the mouth, right? So a patient could have maybe a root canal tooth that's still failing, right? Or they can have an extraction site that you got pulled 30 years ago, but you still got toxins there, right? Or you could have maybe a tooth that's large cavity, right? But you have no idea that you have infection there because it's asymptomatic.
Yeah, and it's traveling throughout the body. In fact, there's lots of conditions that are linked to the problems in the mouth: inflammation, heart disease, diabetes, autoimmune disease, sinus and airway complications, headaches. There's just so many things that could be linked to what's happening in the mouth. And there are those hidden dental dangers. So the issue with a lot of dental problems is kind of like what we talked about earlier with the kidneys, is that disease is marching on for a long time.
Yes.
That's why we should always make sure at the very least that we have our routine dental visits so you can interrupt things before they get worse.
Well, one of the things is that you also need to be able to do a CT scan.
Yeah.
All right, so most dentists, including me for many years, we only had a 2D x-ray.
Yeah.
That means we only see the front of the bone, right? A CT scan is a three-dimensional scan where I can look completely around the entire tooth to see if there's any kind of chronic infection there, right?
Yeah.
And so a lot of times when you have that infection there, it doesn't just stay here.
No.
You know what I'm saying? It's part of your mouth is part of your lymphatic system. It's part of your skeletal system. It's part of your cardiovascular. All that stuff is part of the whole system.
As you and I have always said before, it's like that song we have, the hip bone's connected to the, it's all connected, right? All connected. And then you can also see even how the jaw is functioning. So airway, for example, because oral structures can affect your breathing, your posture, your sleep.
So oxygen, all right? So if you are lacking oxygen, let's say I have sleep apnea, right? So I'm not getting I'm a mouth breather, so I'm not getting really the full amount of oxygen in, right? That's causing my body to be everybody knows that by acidic and alkaline, right? Yeah. We all now understand we got the alkaline water and whatever else, but more importantly, it's actually the oxygen itself. It also what stops you from doing what? Being able to sleep. So if you're not sleeping, then your adrenals are not working correctly, right? So at the end of the day, you have to have some good oxygen in. So we do airway mouth doctor. As an airway mouth doctor, I'm able to expand, because a lot of times you have three problems. You have either you're too low here, or you're too pushed back here, or you're narrow here. Yeah. And these problems cause you to have
and a lot of us are not even aware about it.
And most of us not.
Yeah, in fact, we compensate for it. All right, Deborah, you had veneers about 15 years ago, so you were always into making your teeth look pretty in the whole bit. But then your confidence started to fade when you started having some serious dental issues. What was happening?
When my veneers began to fail, I had about 8 root canals around my mouth.
8 root canals?
Yes, because what happened was that it was a crack in the back, and I didn't realize that they were beautiful in the front, and then my teeth started shifting and moving.
Yeah, that really impacts your self-esteem, because like you literally, we just saw a picture of you smiling there, but you would stop smiling in photos.
Oh, yes.
You started thinking people that were judging you, right?
Yes. It made me not be who I am.
Yeah.
Because when people look at you, they actually they see you, but they see your mouth.
Yeah. And Dr. Collins, here's the deal. If things look fine from the front, we all think it's all good. I mean, I remember getting root canals and getting new crowns. I was like, look at that pretty crown. Never did I think about that crown will lift over the years. And when it lifts, you get, bacteria underneath and the whole bit. So we, again, having to be vigilant with our dental appointments. Okay, so what did you find in Deborah that was going on?
Well, one, she had a lot of chronic infection in the bone, right, because of the root canals that she had. That's number one. Two, she had a lot of metal toxicity going on. So what I do is, it's not just putting implants in. I need to see if your body is healthy. I'm going to put you on a regimen vitamins. She had probably 4 or 5. She still should be taking those vitamins now. But we put you, I'm also a nutritionist, right? So I study all this stuff so that way I can actually tell my patients, this is what I need you to do so that you can be healthy before I even put an implant in you.
Yeah, and you had immune boosting supplements as well, because I know at
Yes.
times if you're going to have something done, oral surgery, for example, there are doctors who will say, I'm going to give you an antibiotic before we even start.
Right,
and
right,
the reason
right.
for doing that is to offset that infection.
offset the infection.
Yeah, but you wanted to make sure that she had the best foundation to
Yes,
work with
yes.
before you were fixing her teeth.
Yes.
And you loved that too, because you've never been to a dentist before that said, okay, let's take these supplements before we get started here.
The very first time. And it boosts my confidence because I felt as though my system was able to be strong in order to be drilled into the bone, because he explains it, we're going into the bone, and that is where the implants are going to be put.
Yeah, that's what anchors those implants. Now, when you say that, a lot of people go, I know I need some help, but that sounds painful. I've had an implant done, and
Right.
I didn't feel a thing. And then for you?
I had implants top and bottom, nothing. I was waiting for, well, I said, doctor, I'm going to need something for pain. And he said, no, you're just going to take the 800 milligrams and you're going to be okay.
Yeah.
And I was. I think the biggest problem in implants was fear, and that I had to wait to eat because I couldn't adjust my lip and tongue.
Yeah, because all of a sudden, again, we compensate, right? And then so now all of a sudden you're back to functioning well. The other thing that's so important too, I know a lot of times when you feel like you've been beaten up and you've gone from place to place and you feel ashamed of your teeth, you go into the office and there's no shame there at all. This is what he does. In fact, you look forward to when something walks in the door, you're like, what do we got this time? Everybody's an individual because everybody's different. But you felt comfortable there.
I felt very comfortable. Even at the clinic, it's a family. I know everybody worked there. Are you comfortable? He always sits down beside you and asks you, what are your fears? What do you want to achieve from this? Because this is a lifetime investment. Once you get your mouth exactly with those implants, I'm going to always have this smile.
Yeah, there you go. You cowboyed up, and look at that smile you got right there. Okay, you say you feel rejuvenated, empowered, reborn, and you say you feel 10 to 15 years younger.
Yes. I see it in the mirror.
And what's the one piece of food? Sometimes when we get older, all we want to do is have a good piece of food. But when your teeth don't let you, you're like, what? Oh, come on, right? So what's the food that you had missed eating that you were finally able to dig into?
Chewing properly.
Yeah, chewing properly, which is important.
And not having to rush, because I didn't want to take longer than other people you're eating with, because I could not get the grip. So now I can eat everything.
Yeah.
Everything. I'm eating
Steak, says the cowboy, right? Yes.
I can actually chew steak and chew it up.
Yeah.
But it has made a difference.
How are your knees?
And I must talk about my knees.
Yeah.
So when I was sitting in the chair, he said, what's going on with you? I said, oh, I'm fine, And I said, well, no, because my right knee hurts. He said, I bet it's coming from your tooth. And
the first thing you think is like, come on now. Oh, yeah, right.
So what happened was, he said, it's probably this one here. When he pulled that tooth out, I had no pain. The infection was all the way up going toward my brain.
Yeah, and studies show that when that, like we talked about, when that bacteria gets out, and then it can trigger autoimmune issues, and in that soft tissue, and especially the tissue around bones, knees, elbows, joints, and a whole bit, that's where it comes from. So behooves you to make sure your teeth are good so it can help the rest of your body.
Yes, ma'am.
Yes.
All right, thank you so much. The Cowboy Dentist has a special offer for Great Day Houston viewers. Get a free consultation and CT scan when you make an appointment, and lifetime warranty when you go through the process. They have 2 locations, one in Manville and the other in Rosenberg. Worth the drive if you're not in that area. You can take advantage of that special offer now by calling 361-D-COWBOY. That works out to be 361-326-9269. 361-326-9269. You can also visit them online at cowboydentist.net.